Hi, I'm Linda and I'm a health visitor. I work for Cardiff and Vale University Health Board. In my role, I work closely with families who have children under 5. I'm privileged to go into their homes, support them with any health or social issues they may have, and most importantly, watch their children grow. It can be a really complex and challenging role, and we work as part of a wider team, signposting families to the best services for them. That might be as simple as a well baby clinic or baby group, to housing support or children's services. Supporting families who are experiencing a difficult time is one of the most rewarding parts of my job. I really admire my colleagues. They have a fantastic work ethic, and I'm really proud of my profession. I've been a health visitor for a long time because I love it. Having worked previously as a midwife, it felt like a natural career progression for me. Nurses and midwives who come to health visiting bring a wealth of experience and skills. I feel I am able to make a difference to the service and my family's lives. Being a health visitor has strengthened my communication skills, which is a personal bonus. It has enhanced my own relationships, and I believe that working within health visiting has made me a better person. 3 words I use to describe my work are supportive, stimulating, and rewarding. We are the NHS. Choose health visiting.